Monkeypox is spreading and children are getting it. Hi, everybody. This is Dr. David. Now, I want to report on some very new data that was just released in the New England Journal of Medicine. And it is a very comprehensive study, by far the most data that we have had since we started learning about monkeypox a few months ago. Now, what they report on is that in America, there have been over 3,500 cases of monkeypox reported, 35,000 throughout the world. Now, this is probably a significant undercounting because monkeypox is not yet, although there supposedly is discussion about making this different, but it is not yet considered a mandatory reportable disease. Now, there are certain diseases like measles and mumps, rubella, tuberculosis, anthrax that are mandatory reporting. If a doctor catches it, diagnoses it, finds it in a lab test, the lab has to report it, and then we get more accurate research numbers about that. But that's not where we are yet at monkeypox. So this is probably an underreporting. And there definitely would be some people who maybe because they caught it, maybe they were embarrassed. Who knows that maybe they didn't want to report on it. But 900 cases in New York so far, about over 300 cases in Florida. Obviously, other states in the country as well. I think every single state except for like three or four now has not reported at least one case. Okay. Now, in this report, 98% of the cases were in gay men, men having sex with men. Now, I've said this before, and I so strongly want to reiterate this is not a gay disease. Now, it is a sexually transmitted disease because it's transmitted during sex, which is something that I commented at the very beginning of this thing when they were calling it not a sexually transmitted disease, and kind of seemed obvious to me. But this is about people having sex with other people, and it happens to be spreading in the gay community, very similarly to the way HIV started. But we learned very soon after that, or maybe not very soon, but soon after, we learned, of course, this was not just something that was being transmitted between men. It was certainly being passed along intersex, if you will. But it's just that, when they were in the case of HIV, the passing of seminal fluids, bodily fluids, mucosal membrane fluids, that's what was passing it along. Now, in monkeypox, um, there does seem to be some similarities and some differences here, but really the similarity with HIV ends with the fact that again it's not being passed along through those types of fluid, more the membranes, more this ruptured skin, etc. But one of the interesting things about this in this report is that about 40% of the people who tested positive for monkeypox also have HIV. So this may be showing up more in people who are vulnerable, who have potentially weakened immune systems. That's a fairly large number of people with that type of comorbidity, a risk factor for sure. But there also has been two children who have definitely tested positive in America. They're not related to each other, different parts of the country even. And it seems as if this passed through household contact. Okay. Now, monkeypox is passed besides rubbing up against a lesion or rough skin, which becomes the rash. It also can be passed through respiratory droplets, much less so than aerosols. And if you remember, even in our early discussions about COVID, respiratory droplets are much more solid, heavier substances that don't spread out into the air. They don't accumulate the way that aerosols does. They're heavy, they fall to the ground. So there has to be a much closer contact with that person. We soon learned that the 6 feet of physical distancing from COVID was what needed. We know it probably was way more than 6 feet, 10 feet, 12 feet, but it's in the air. It's in the aerosols. We know that in measles in particular, we know it can stay in the air for up to 4 hours after a person's left that room if they had measles and they passed it along. So this is something certainly, of course, all families should be mindful of. And of course, as a country, we should be mindful of. But of course, this is not the type of thing that is spreading like wildfire the way that a lot of other diseases do. Now, I want to talk a little bit more about it in general, okay? Because this starts off with a more general flu like illness, fever, weakness, tiredness, just feeling run down, respiratory, sore throats. That's the type of symptoms. The flu, many of the cold symptoms, we talked about common symptoms of COVID. But then eventually, that's when the pox come out. And now I'm going to talk a little bit more about chicken pox, but these are bigger and more firm and last longer, and they're more painful. Okay, and a person is contagious with monkeypox from really the first time that they have any symptom whatsoever until after all of the pox have either crusted over or fallen off altogether. But I did want to make a little comment because you haven't heard much talk about this relative to chickenpox, which I felt we would have heard more about, especially since they both have the same second part of the word pox. Okay, so I wanted to do a little bit of a comparing and contrasting as well, especially since chickenpox has more been a pediatric disease, although now we are seeing some more in adults, and of course, shingles is still considered a problem. It is a problem, not considered a problem. Now, what are some of the similarities? Now, these are both DNA viruses, and if you remember, SARS-CoV-2 is an RNA virus. Okay, so this is a different category altogether. Now, monkeypox is in the category of viruses called an orthopox, whereas chickenpox is actually a herpes virus. Okay, now smallpox is actually in the same family as monkeypox, as is cowpox. And I think that that's interesting and wanting to point out one thing because when smallpox was around 100 years ago or so, and it was a devastating disease, much more dangerous than what we're talking about here. But cowpox, and this was something that was actually in cows, but some farmers would get it. But the first vaccine against smallpox was actually inoculating somebody with the benign cowpox. Now, because they are in the same family, that's the reason why the smallpox vaccine and where they're developing from is covering for people who have monkeypox. But chickenpox vaccine wouldn't do anything against monkeypox. Now, they both do start off like a flu-like illness. They both do go on into the secondary rash. Chickenpox, however, the rash typically lasts much shorter period of time than monkeypox does. Um, Also, chickenpox is a lot more contagious than monkeypox is. There is more aerosol type of spread than what we're seeing with monkeypox. Now, um, and of course, with that, monkeypox is being spread more through rashes, and of course, chickenpox does too. We know that chickenpox, again, if you touch one of the lesions with it, that's one of the things in chickenpox that can spread. And we know that when a person has a reactivation of their chickenpox, which is called zoster or shingles, that it's really contact with those lesions that open up that reappear. That is what a person is contagious from. Okay, so where does this all mean in the summer of 2022? It means, again, be mindful of this. Again, there is really no indication at this point that this is going to have a tremendous type of spread into any kind of pandemic. Of course, time is going to tell. We're still learning a lot about this virus. Has there been changes in its genetic code compared to the early ones? But, thankfully, first of all, we're more aware of spreading viruses these days. Everybody are. So, of course, it's going to be more in our news. And, of course, it's going to be something more on the rest of our minds. But how could it not be after everything we've been through for the last 2.5 years? But does this need to be a five-alarm fire? No. Do people who are in high risk groups, in particular men who are having sex with men, need to be much more mindful of their activities if they want to reduce the possibility of getting this? Might the people who are participating in these types of activities, may the benefit versus risk of the vaccine be more significant in the positive for them? It possibly may. And as you know, and I've always talked about, when it comes to any type of vaccine or any type of medical intervention, we always have to weigh the potential benefit versus the potential risk. So I hope you learned something today. If you haven't subscribed to our YouTube channel, please do so. And of course, join us on our other social media platforms as well. Join us on our Patreon, where we continue to put up new and personalized and much more exclusive content there for you as well. You like what you saw? Watch another one. Click right here.